Is gastric adenocarcinoma hereditary? When we talk about gastric adenocarcinoma, the most common type of stomach cancer, a common question arises: is it hereditary? The answer is a bit complex. Most cases of gastric adenocarcinoma are sporadic, meaning they occur without a clear inherited cause. However, research shows that about 10% of these cases can show familial patterns, where several family members may be affected. In a smaller fraction, around 1% to 3%, a hereditary cause can be identified. One of the most recognized hereditary forms of gastric adenocarcinoma is hereditary diffuse gastric cancer, often referred to as HDGC. This condition is primarily caused by mutations in the CDH1 gene. This gene is responsible for producing a protein called E-cadherin, which helps cells stick together and prevents tumor formation. When mutations occur in this gene, the risk of developing diffuse-type gastric adenocarcinoma significantly increases. Individuals with HDGC can have up to a 70% lifetime risk of developing stomach cancer, and they often face this diagnosis at a younger age compared to those with sporadic cases. There are also other hereditary syndromes that can increase the risk of gastric adenocarcinoma. For instance, gastric adenocarcinoma and proximal polyposis of the stomach, known as GAPPS, is linked to mutations in the promoter region of the APC gene. Familial intestinal gastric cancer, or FIG, has a less understood genetic basis but is also associated with increased risk. Additionally, there are syndromes primarily known for other types of cancer that can also elevate the risk of stomach cancer. These include Lynch syndrome, which is caused by mutations in DNA mismatch repair genes, familial adenomatous polyposis, Peutz-Jeghers syndrome, juvenile polyposis syndrome, Li-Fraumeni syndrome, Cowden syndrome, and hereditary breast and ovarian cancer syndrome. Understanding these hereditary forms of gastric cancer is crucial. It can help guide surveillance strategies, early detection, and preventive measures, such as prophylactic gastrectomy for those at high risk. For families with multiple cases of gastric cancer or instances of early onset disease, genetic counseling and testing are strongly recommended. This can clarify risk levels and management options. Summary: while the majority of gastric adenocarcinomas are not hereditary, a small percentage do stem from inherited genetic mutations, particularly in the CDH1 gene associated with hereditary diffuse gastric cancer. Recognizing these hereditary forms is essential for targeted prevention and treatment in families affected by this condition. Always consult healthcare professionals for personalized advice and guidance regarding cancer risks and management.